A looming crisis, the skyrocketing cost of healthcare insurance. The future of healthcare insurance in the United States is facing a critical juncture, with a predicted 26% increase in prices for Obamacare plans. This news, released just days before enrollment, has sent shockwaves through the healthcare landscape. But here's where it gets even more concerning. The financial burden for millions of Americans could be far more severe than the initial figures suggest. According to a recent analysis by the Kaiser Family Foundation, consumers shopping for health insurance through the Affordable Care Act, ACA, marketplaces are in for a rude awakening. The average price increase of 26% is one of the sharpest rises since the program's inception over a decade ago. And for those using the federal Healthcare.gov platform, the hikes could be even more drastic, averaging a staggering 30%. State-run marketplaces are not immune, with a predicted 17% increase. But the real concern lies in the potential expiration of enhanced subsidies, which have been a lifeline for millions of Americans, keeping premiums affordable. If these subsidies are not extended, many households could face a doubling or even tripling of their out-of-pocket expenses, as per the KFF's findings. The research highlights a potential 114% increase in monthly payments for subsidized enrollees if Congress fails to act. This scenario is already playing out on the Healthcare.gov website, which is displaying the higher costs, reflecting the lapse in assistance. Healthcare affordability has become a battleground in Washington, with the budget standoff now the second longest government shutdown in U.S. history. Senate Democrats are adamant that any funding deal must include an extension of the enhanced subsidies, while Trump and Republicans refuse to negotiate until the government is fully operational again. The impasse has led to calls for an immediate end to the shutdown, with Everett Kelly, leader of the American Federation of Government Employees, urging a resolution. Yet, Senate Democratic leader Chuck Schumer remains unwavering, pointing to the impending healthcare crisis. He warns of panic among millions of families as they face dramatically higher bills over the coming weekend. Republicans, however, argue that Democrats are being irresponsible by refusing to support the funding measure approved by House Republicans last month. The extension of these subsidies would require a significant federal investment, estimated at $350 billion over the next decade, according to the Congressional Budget Office. The enhanced tax credits, initially approved by a Democratic Congress, have been instrumental in driving marketplace enrollment to record levels, with over 24 million people enrolled this year. Under the new pricing structure, only 60% of those signing up for 2026 coverage will find plans at or below $50 a month, compared to 83% in the previous year. If the enhanced assistance expires, millions more Americans could find themselves without insurance by 2034, as projected by the Congressional Budget Office. This crisis is a stark reminder of the fragility of healthcare access and the potential impact on millions of lives. It raises important questions. How can we ensure affordable healthcare for all? Is the current system sustainable? And what steps can be taken to prevent such drastic increases in the future? The debate is sure to continue, and we invite you to share your thoughts and opinions in the comments below.